Arterial circulation. Arterial circulation into the feet. Peripheral circulation problems are potentially the most damaging to the foot. Without proper blood flow to the foot, the tissues of the foot will suffer and in some cases die, gangrene. Unfortunately, as we age, our peripheral circulation to our feet does become impaired. When the foot is examined in regards to peripheral circulation, we note the following: ability to feel pulses and the strength of those pulses, color and texture of the skin, hair distribution, as loss of hair can but not always signal a loss of circulation to the foot, rashes, ulcers, venous patterns and venous enlargement, edema, swelling, temperature decreases, temperature differences between the 2 feet. In general, 1 cold foot is suggestive of poor circulation, 2 cold feet may be indicative of anxiety, neurological or a cold environment. What is atherosclerosis? The most common cause of poor blood flow into the foot is atherosclerosis or hardening of the arteries. This is a progressive degenerative process characterized by the deposition of fatty substances inside the wall of the artery along with a fibrous thickening of the artery wall, resulting in a diminished ability of blood to flow down to the foot. This condition in most people will go undiagnosed until the condition becomes symptomatic. When the initial symptoms of intermittent claudication, pain in the calf after walking a short distance, although to a lesser extent the thighs and buttocks, presents, there is already significant disease present. What is essentially happening? Due to blockages in the blood flow to the feet, there is a mismatch between the oxygen supply being supplied to the extremities and the metabolic demands of the muscles of the feet and lower legs upon exertion. Simply stated, when muscles are working, they need fresh oxygen to supply them. Any reduction in this oxygen supply to a muscle will cause pain, claudication. Major causes of atherosclerosis include diabetes, which affects both the major blood vessels bringing blood into the foot and the smaller vessels, which actually supply each area of the foot. Hypertension or high blood pressure can also cause damage to the arteries of the foot and leg and over time diminish blood flow to the feet. It is also worth mentioning that some antihypertensive medicine will also adversely affect the feet in that they can cause swelling and discoloration of the extremities. Smoking, however, may be the worst cause of damage to the arteries that bring blood to the feet, as well as the heart, brain, and kidneys. Smoke from tobacco directly damages the inside of the arteries. Treatment of atherosclerosis. There are a few different treatments for arteriosclerosis in the lower extremity, and treatment is based on a number of factors including the degree of blockage either by occlusion, calcified plaque, or by stenosis, narrowing of the artery, the age of the patient, their general overall health, etc. Walking is considered the primary treatment in treating arteriosclerosis in mild to moderate cases. In fact, walking works better than oral medication. However, we are talking about a daily walking program on a graded treadmill for 30 minutes. This should be a supervised program and you should have clearance from your doctor. Exercise on a regimented, physician-supervised program can reduce the symptoms of intermittent claudication in as little as 6 months in many individuals. Medications used for peripheral arterial disease include Cilostazol, which increases blood flow by dilating, opening up, arteries, and pentoxifylline, which works by making red blood cells more pliable so they can squeeze through narrow arteries. In cases where exercise and medication fail to alleviate the problem, surgery is usually the answer to opening up the blockage. Read the complete article at www.foot-explained.com/peripheral_circulatIon.html.